Good afternoon and welcome to all of you to today's webinar titled COVID-19 and its effects on minorities. We're broadcasting live from the Eurac European Research Academy in Bozen, Northern Italy, South Tyrol. A special welcome to our three expert contributors: Ilze Brands-Kehris, Assistant Secretary General for Human Rights at the Human Rights Office in New York; Lamberto, Zannier, OSCE High Commissioner on National Minorities, talking to us today from The Hague; and Marko, Head of the Institute for Minority Rights at Eurac Research, broadcasting, talking to us today from the University of Graz. My name is Georg Grote. I'm a historian and senior researcher at the Institute for Minority Rights here in Bozen. I would like to ask Lamberto Zannier first to talk to us about the threat or the options that COVID-19 may pose on minorities. So what I want to do is I want to outline briefly the structure of today's talk. We're going to start by sort of short statements on the issue, and then there will be an opportunity to join our conversation by adding comments or posing questions from the audience. These inputs will be screened by my colleague Sergio Constantine, and the selection then passed on to me. In total, we have about 60 minutes at our disposal. So I'd like to get started by posing the question to our experts. Judging from today, May the 13th, 2020, what effects has COVID-19 had on minorities? And what do we need to be aware of in the post-COVID period? Can I ask Lamberto to join us first?
Yes, I think what we need to do is to focus on the longer term, actually. The governments have taken a number of extraordinary measures as the outbreak of the pandemic, and we've been looking at these measures, and we have been wondering the extent to which they can have an impact on minorities. Of course, they have an impact on societies in general, because societies have become more diverse, and this diversity in the societies leads to some kind of discrimination, and we've seen also in the media, also in the West, that certain groups are somehow discriminated or singled out when it comes to responses to the pandemic. So what we have done is we have identified a number of key principles that we have put forward and publicized. Principles, first of all, upholding human rights, the need to be inclusive in the responses, the need to be sensitive to the specific needs of various different groups, so language needs, for instance, protecting those who can be economically vulnerable, so the weakest parts of the society, maintaining zero tolerance for discrimination, for hate speech. I think this is a risk that we have seen in various circumstances. And then building on positive examples to promote social cohesion. I think promoting social cohesion in these emergency, in these difficult times is more challenging, but is more important, because these are things that down the line, if unaddressed, can create divisions within society and thereby creating stability. So the risks we are focusing on, and on the basis of these principles, we have issued a set of detailed recommendations to the members of the OSCE. And the issues we are focusing on are risks of various kinds. First of all, health risks, and see what are the most vulnerable social groups. Do they have enough access to health care? Are they penalized if their language is not used, etc.? Social risks, the impact on certain communities, for instance, the Roma. We have seen a number of cases of discrimination of that. Economic risks, very often minorities, and I try not to define minorities here because we would enter into a very complicated debate, but very often people who belong to minorities are people that are also economically more vulnerable, often front line workers, people work in the healthcare system, in the transport system, in the retail economy, in factories, etc. And so they have been affected by closures. And then security risks and the actions of the police that have stronger powers and making sure there is no discrimination at that level. So there is quite a broad range of things that need to be brought into focus. And looking, and there are problems, and there are also good practices. So we are looking at both of these things. And final point, monitoring is challenging because obviously traveling is a problem. So we need to rely also on multiple sources to have a better understanding of what's going on.
Thank you very much. Can I ask Ilze Brands-Kehris to come in and give us her view from the UN in New York?
Thank you very much. Yes, thank you first of all for organizing this, and it's very encouraging that you're also doing a series, which I think is perfect, so we can hone in on the specific issues later on, and happy to be engaged in dialogue with you. I do certainly agree with Lamberto on the types of challenges, so I won't repeat those, but let me start maybe by the picture of where we're at, the threat that came so suddenly, but also if we can lose to it or we can make it an opportunity. And this, I think, is that the need has been made so evident of multilateralism, with the whole setting that we've had for years, discussions that multilateralism is sort of being eroded. This clearly shows that we really need multilateralism and cooperation across the globe. I also think it has shown that the answers, when we are going to find answers to the immediate crisis solutions, as well as the longer term, we really need to put human rights at the core. It's people-centered, and this shows it more than ever how that is needed, but also because it actually leads to better outcomes. This is the way, and precisely in the longer term perspective that Lamberto was mentioning, that I agree with, we really need to remember this when we go ahead, when we address those structural issues, for instance, but also the immediate concerns and health concerns we have. I also think that it is a way, we always talk about how all human rights are indivisible and universal. We often say it, and then we still go off in dealing with social economic rights, cultural rights, and then on the other hand, civil and political rights. This crisis has shown to all of us that the rights really are intertwined, that we can't deal with one without the other. All of these issues makes it evident how connected they are. And another point, particularly when we come to minorities, and of course from a UN perspective, we will also deal with indigenous peoples in this context. And this is really that we do, of course, the evidence is being gathered. We don't have yet enough evidence, but it's very clear already that the risks are there, that there are much more vulnerable populations in various contexts across the world, both in terms of access to health, in terms of economic precarious employment and low income, but in many other ways as well. The limitations to movement, for instance, affect people very differently. What we do see again that has been made evident in this crisis, we always talk about the need to have data, disaggregated data, and this shows the absolute need for it. We have the countries, the UK and the US, for instance, do collect such data, and they have identified very clearly the much higher risk and much higher death rates of minority populations, Black populations in America. And also because there are structural problems with access to healthcare, and there are health issues that have not been solved for decades that actually make these populations more vulnerable. So this is proof, if we ever had it, that we really need to go ahead and have the data. I have many other issues. Some of them were mentioned already, but I'm sure they'll come up in discussion. So I will stop here for the introduction.
Thank you so much. Thank you so much. There are so many points that we'll have to come back to. Can I ask Marko to give his comment on what we've heard so far and where his priorities lie?
Yeah, thank you, Georg. I can simply follow up with the two previous speakers. Also from my place here in Graz and the locked down city here in Graz, what we happen to see here in Austria in general is that every pandemic is some sort of an X-ray of state and society. So what we see here at the very moment is more or less a very clear picture about the strengths and weaknesses of our states and societies, our liberal democracies, and pluralistic and diverse societies, which we would like to see. But at the very moment, we see a lot of black and white pictures. On the one hand, we have all these heroes of everyday life now applauded on TV and in the other media. So the female cashiers in supermarkets having been working from the very beginning without health protection, and at the same time the military deployed to the supermarkets to help the employees of the supermarkets to bring food to the tracts, to the rackets. So on the one hand, we have a lot of solidarity seen, astonishing lot of solidarity. There was no fragmentation any longer, no talk about fragmentation. On the other hand, of course, again, a lot of egotism, egocentric behavior. So people jumping the queue again before the cashier desk in a supermarket. And at the same time, because I'm much more concerned also together with Ilze about the middle term and long-term effects, and particularly for minority protection, a lot of critique against civil servile obedience of the population at large vis-a-vis governmental decrees on the one hand. So that you have a lot of criticism in Austria also raised already. Well, are Austrians like in the Habsburg monarchy still all these people trained to obey the instructions of the emperor and what else? So on the one hand, we have a lot of social distancing, which is the new catchword of the year 2020, I guess. And on the other hand, the very, very important catchword in the OSCE recommendations with regard to social cohesion. So how does social cohesion and social distancing fit together? And let me give only, again, two examples from Germany. Today we could read in our newspapers, but also in the Swiss newspapers, about protest demonstrations in Germany, requiring freedom, to give up all these lockdowns measures and the restrictions, and that every restriction of a human right is by definition a violation of human rights. And you can hear a lot of conspiracy theories and what is called now already going on an infodemic, not only through the social media, not only hate speech, but also fake news about the coronavirus and the spread of the coronavirus. And what you can see here in these protest demonstrations in Germany, it's again, the alternative for Germany trying to politically mobilize together with neo-populist speakers to mobilize people, referring to absolute freedom of speech, freedom of demonstration, what else? However, all these people are also known to be anti-Semitic, xenophobic, and even one of these guys and one of the organizers of this protest demonstration is a Holocaust denier. So what we are requiring now is not only simply tolerance and say, well, we need more access also for each and every person to health service, and how effective are our public services in general. What we can see here, triggered by the pandemic, is also a revival of nationalism and even neo-racism or even old racism, so that the question is raised for me now, is it enough, simply to fight anti-discrimination? Do we have to go also into the deep structures, as this has been called by Ilze already, with structural discrimination, that we have to go to the roots of the problems of the nation states? And in this regard also, you mentioned multilateralism. What we see now with regard to European integration, we have closed borders, bilateral measures between member states of the European Union. Austria will open its borders to Germany in the beginning of next week. But again, this is now the question, is this enough? And most of our health services, in particular the care for the elderly in geriatric care or nursing homes, people come from Slovakia, Romania, the Ukraine. So more than 100,000 people are taking care of Austrians in the nursery homes in Austria, with all the problems now, to have an effective exchange of these people taking care of the elderly people in Austria. And at the very moment also there are negotiations between the Austrian government and other governments like the Ukraine to bring in agricultural workers, farmhands, for the harvesting of asparagus now in Austria. So this is, let me say it this way, very frankly, in almost a provocative way, this is the backside of the moon of European integration. This East-West divide, or in some way or the other, also a North-South divide of the welfare states within the European Union in Central and Northern Europe, not to speak about the demographic disaster also happening in Southeast Europe. Many people from Macedonia have completely emigrated from Macedonia. The northern part of Macedonia, outside the territory where the Albanian population lives, is almost emptied by now. How does this to come to an end? How does this affect minorities? Yeah. Again, I can only follow up with Ilze. We still distinguish about with regard to different categories of minorities. And again, as I could read from a report of the Fundamental Rights Agency in Vienna, the Austrian Integration Fund has translated all the COVID-19 laws and regulations of the Austrian government into 17 languages. And do you know which languages? Chinese, Farsi, Turkish, Kurdish, and so on, but not into the languages of national minorities. Yeah. So again, I think that national minorities, the traditional national minorities, again, completely marginalized at the very moment, not only in terms of their use of the languages. You have already mentioned indigenous populations, so I do not go on into this question. But what I fear is a worst case scenario, that segregation and assimilation instead of integration in order to foster social cohesion will become more and more normalized. Become mainstream, and this is the real danger I see for minorities far away and beyond discrimination. And therefore, I will really argue that we have to talk much more about structural discrimination and how to avoid institutional segregation of all sorts of vulnerable peoples.
Thank you so much. Thank you for your three opening statements, which have already triggered a lot of questions. The questions come in hard and heavy and very quickly. And on that last point that you made, Josef, there's a question coming in, and I'll read it out. How could you, the panel, comment or react to the argument that collecting disaggregated data by ethnicity and race is another step into the direction of discriminating and singling out members of minorities? I think that goes very much in the direction that you've just mentioned.
Well,
whoever.
First of all, we are not really in the business of collecting disaggregated data, but we are trying to communicate with the minorities because we need to understand how they see themselves and what issues they face. We are, of course, also using data that come in. For instance, today I've seen that the FUN, it's a network of selected group of minority organizations and also self-defined in a way. Yeah. But they've run a survey and they gave some statistics on the use of minority languages in the response to COVID. And there are some interesting elements there. For instance, they say that emergency hotlines set up by states in Europe, only in 21% of the cases use minority languages. So there is a risk that people that belong to, and I'm not passing a a judgment on this figure. I'm not sure what it's based on, but it gives a sense of the direction or the kind of the problem that we are facing.
Yeah.
That in the response, this issue has been largely ignored. So people who belong to national minorities and who might have a problem in terms of being comfortable using the state language of the country where they live, they might have an handicap because of that inability for them to express themselves, to understand perhaps even properly the instructions that are being given to the population. There are some very good examples that go in the other direction. We have seen in many places that many languages are used by governments, by local municipalities and the local administrations, etc. So there are good practices, but generally there seems to be a problem there. So it is important to find ways to understand the problem. I don't think that this amounts to in a way contributing to discriminating. But because societies are diverse, so we need to factor this diversity in our analysis. Otherwise, we wouldn't be able to operate.
I think Ilze in particular mentioned the collection of data, and I think the fear or the question that was posed was going in the direction: can the collection of data be used against minorities as well? Because we're basically mapping minorities through data, through material, and they can then be sort of marginalized even more afterwards. Ilze, would you like to comment on that?
Yes, I would. I think it's a very important concern. And
Yes.
Of course, it's not a new one. It's one that we've had for years when we've been talking about data collection. And we know that countries actually have very different legislation for this for various reasons. And also history, of course, plays into it, and the fear that is based on the misuse of ethnic data. So, of course, it's perfectly legitimate to raise those concerns, and we need to think about it. There is, of course, in minority rights to begin with, the identification is, of course, a voluntary self-identification. So there is no one can be forced to, it's not an ascribed identity, and no one is forced to give their ethnic identity, or should not be in any case. But what we do see, and secondly, of course, it has to be done in a way that protects the data, the way it's collected, the way it's also processed, and the way it's used for specific purposes has to comply with data protection legislation and norms, also to be anonymized, not to be traced back to individuals and so on. But the point is that in this case, we do see the need for the evidence, which is what those proponents of data collection have always said, that we can't have specific policies that are able to target populations that are particularly exposed to various risks unless we have that data. And I think in this case, we really see it very clearly that is the case. An example, for instance, to take positive action is we have in the UK, where they, because of the data they collected, they realized that ethnic minority health workers and social workers were more vulnerable, more exposed to the virus and got more sick. So therefore, there was a targeted program to provide them as a matter of priority, the personal protection equipment. And that's one of those things that could not have been done unless the data was there. So of course, there's an issue of taking on to do it in a way so it's not misused, but do it in a way so that we can formulate policies that actually target the population that it needs.
However, that raises the issue of varying standards and a lack of a universal standard in various different things. I was just thinking while you were talking about, I was thinking about that much discussed telephone app that is sort of, that everybody's talking about, but there seem to be various standards and various different ways of implementing this telephone app. So various degrees of data protection as well. Another question that comes in that goes hand in hand with this discussion is the question to the panel: how many United Nations and OSCE countries have respectively made health policies designed specifically for minorities and indigenous peoples?
Can you repeat the question? Sorry.
Yeah. How many UN and OSCE countries have made health policies specifically designed for minorities and indigenous peoples? Is there such a thing? Because that raises a major issue. I mean, I'm thinking of sort of the various standards. These indigenous peoples in the Amazon forests come to mind, for example, at this moment, because they're suffering a completely different set of effects of COVID-19 than somebody in Western Europe would, for example. Are there specific health legislation or health measures designed for minorities in UN and OSCE states?
No,
Well,
sorry.
Yeah, no, and maybe, I mean, it's a very good question, because that's exactly leads in the direction of what should be done probably.
Yes.
There are examples in the world. There are not very many of them, but there are some good practices examples in this too, and particularly when it concerns indigenous peoples. Also, we have the Australian government, for instance, with the Aboriginal and Torres Strait Islanders that have particularly made and the point there, I think, is very important as well for all communities, but of course it's also a specific right for indigenous populations, is the right to be, to really be consulted and to be part of decision, the right to participate fully. And the example there is good for that practice as well, that it's the government, the initiative, but taken in consultations with the representative body, so that they really, the issue is to provide both culturally and linguistically appropriate medical care and access to health services that are that way. There are a few other countries as well, including Brazil, despite the very negative coverage that we do have. There also are some efforts that are being made in reaching out to people. In Canada, we have it with the Inuit as well. That so there are particular examples like this, but I would say that they're mostly, and of course also the language issue that was mentioned earlier by Lamberto, that there are countries that do that have explicitly made sure that the incorporation, that there's also information available in minority languages beyond indigenous peoples. But I think that would be another one that we should gather evidence on, and hopefully there will be more examples as we go on.
There's one more example. Sweden, for example, has one as well. The comment is just coming in. Lamberto, do you want to come in on that question too?
Yeah. The way we look at this is that, first of all, there is a right to health by everybody, majority and minority. So this is not an area where we would like to see discriminations. And therefore, we have covered this in our own recommendations, asking OSCE participating states to be inclusive in their policies, to make sure that they engage also representatives of minority communities, in some cases also hiring them and making them part of the groups that develop policies targeting the pandemics, so that the needs and the special needs of the communities are factored into these policies as they are being designed. So to us, the response has to be through inclusiveness and ensuring that all the groups of the society are represented in the mechanism of response, and that their needs are taken into account.
Okay, I think Josef is coming in on this.
No, I want to return back and
Okay.
combine this with the data protection question. And I think there is one confusion, overall confusion, a simplification, that you say, well, when you collect data, this is automatically a violation of data protection. No, and this is not true. This is a one-sided simplification, because when you collect data and they are unanimous and in statistics, then this is what we call evidence-based. So everybody is speaking now at the very moment for the need of evidence-based policy recommendations in all the fields, in various fields, not only in this in the field of medicine. Yeah, we had not even years, but decades of discussions within the Council of Europe, for instance, and I have been working together with Ilze in the advisory committee under the Framework Convention for the Protection of National Minorities, and we had always also the arguments of certain governments that data collection is not allowed because this violates their constitutional principles. In particular, I talk here about France, yeah, and the French situation where it is simply prohibited to collect any data with regard to language or ethnicity or religion, what else, yeah. But on the other hand, how can you really provide help and foster and provide help for vulnerable groups without evidence? And this is the case why we need evidence-based data. And of course, we need also the necessary protection that these data can be misused by disaggregation again. First of all, this means that we have to see into this very complex field that we need data for the development of the respective policies, that we have to protect these data again against misuse and against disaggregation, so that you can find out about the life story of each and every single person. But finally, what we see at the very moment, everybody is carrying on his own mobile, and so we are already a society where all the major companies in the Silicon Valley can track down each and everything what I do. If I try to buy a book with Amazon. So on the one hand, we are almost hysterical about data protection in some way, and we should not throw the baby into the bathwater with regard to to data protection.
In a way, you're raising a very interesting point there. So the individual response to the crisis, and then the kind of the social or the collective response to it. The question arises, is what we're experiencing at the moment, is this comparable to a war without weapons, basically? Are we redrawing the lines of civilization post-COVID-19? Do we have to redefine and restructure our societies in a way that post-war societies always had to do? Because as Ilze was saying earlier on in introductory statements, we have a kind of an intertwining or a meddling of social issues, minority issues, individual issues, health issues, and all of that needs to be completely disentangled and restructured. Would you agree to that particular view that one can read occasionally in the papers these days?
If I may again respond first, I do not really agree to compare this pandemic with a post-war situation. So the situation after World War I, or with the Spanish influenza having killed millions of people in Central Europe, or the situation after World War II, have been completely different from where we are now. What we have now here in Central Europe, in the Nordic countries in particular, is very highly developed, socioeconomically highly developed welfare states. And what I see here is that we have to rethink our basic principles, to come back to the initial statement by Lamberto. What are our initial principles for living together? Human rights, minority protection. Can you disentangle human rights from minorities, from vulnerable groups? And we all agree human rights and minority rights are indivisible. And all people need respect and protection and promotion according to their needs, to their diverse needs. And the same is true also for the question of diversity. So we have a lot of diversity at the same time, but however, we see now all these public discourse, which is no longer a discourse on, well, multiculturalism is dead, as we had it 10 years ago with Angela Merkel and Tony Blair and others, arguing along these lines. Of course, this situation is different and is even more dangerous, because what we see here now with the rise of right-wing populism and parties winning many more votes in general elections with right-wing populism is based on what I call nativism. And therefore one sort of form of neo-racism. And this is the real danger, that due to the problems we have now in Europe with regard to European integration, that all these voices arguing now we have to go back to the nation states as the fortress as a fortress to protect ourselves against the natural disasters, but also against the others who are bringing natural disasters to us. This is the real danger which I see here and which must be fought against through renewed efforts for multilateralism. And in this respect, I fully agree, of course, with Ilze, that there's a lot of need also in terms not only of multilateralism between the nation states, the member states of the United Nations, but also, of course, in my opinion, between the international organizations like the UN and the OSCE, the Council of Europe, and the European Union institutions.
If I can come in on this with some consideration, I think much depends on us and how we handle this, us meaning all of us and our leaders, first of all. I've been already pointed out a number of problematic trends when it comes in general to dealing with minorities. An increasing identity politics within countries that tend to set majority against somehow the minorities and to create tensions within societies that are growing increasingly diverse. And beyond also the traditional minorities, it's also the diversity that is in a way growing because of the movements of people, the migrants and all this. So this is certainly one thing. The other is the increasing geopolitical confrontation that we are seeing in recent times that has weakened multilateralism. And I find it pretty worrying that there are attempts to interpret in geopolitical ways even the pandemic. We are, I think, in a historical phase when we face global challenges across the board, from climate change to the demographic crisis, to the migration challenge. And the pandemic is another one of these. Now, to address these issues, we need global strategies. So strategies, we need to join forces because we face the same problem. We can't accuse each other of being the source of the problem or simply close the borders and try to deal with them within our borders, because these are global problems. So you need to have strategies that are inclusive, that are agreed, and so this is why we need more multilateralism. I think it's essential for our future. If we fail to do that, and if we go down the way of trying to close ourselves within our shell and deal with our problems individually, etc., and weakening the multilateral mechanism in which we invested so much in the last 50 years, I think that then we will have a major problem. And then we will see that, in fact, this pandemic has been another watershed and another step towards a more dysfunctional world where we will have many more issues to address.
I think you're 100% right, but haven't we seen in the last couple of weeks and months that return to the nation state? It was the European nations that took unilateral actions, closed the borders. We see an emergence of us and them rhetorics across the world. Yes. We see populist leaders of the free world who are trying to push through their divisive agendas, political agendas, hiding behind COVID and hiding behind emergency legislation and so on. Are we not going in exactly the other direction to the one that should be desirable?
I fear so, but Ilze.
Yeah, I'm not sure who addresses these. I agree, of course, again, with all the concerns, but I wanted also to say, if we take on the lens of the global, looking at the global situation, we of course have, although, by the way, in this as well, Europe is not excluded, of course, but we do see across the world the abuse of the situation by regimes that have authoritarian tendencies. We have seen some in Europe as well, but certainly the kinds of the control of movement, but also the measures imposed, emergency measures in general, that have given extraordinary powers in certain circumstances to controlling the population, to fining people for detention, arrests, even for people who are violating the regime of lockdown and so on. And there the fear is, of course, that this is something, and that very often goes hand in hand with this kind of populistic use of it's back to our being internal inside our shells. We're protecting our borders, we're keeping everyone here, plus a very strong level of government control over its own population. So exactly in the opposite direction from liberal democracies. And I think the verdict is still out on the narrative of who is best placed to actually act better to control the virus. So this is again something that we need to engage on. And the risk there is, of course, that these kinds of measures taken by regimes who perhaps already had a tendency to do so, that there's no time limit to them, that they often will extend into something that actually goes in a direction that definitely diminishes democracy and diminishes the rights of all populations, but specifically, obviously, minorities are even more exposed than others. We've seen situations where minorities have been targeted in those kinds of surveillance movements, for instance, that they are particularly looked after, that plays into this xenophobia and making sure that we keep track of these populations. So I think that this is a very serious issue, again, that we need to deal with multilaterally. The UN has, the Secretary General issued guidelines also. There's so many guidelines coming these days, but I think luckily they actually tend to agree on most key points. But the Secretary General issued guidelines for COVID and human rights. So it's a broad one exactly in getting the better outcomes, and then has very specific ones coming several times a week. The Office for the High Commissioner of Human Rights also, we have had a series of very particular ones. We have focused in on groups. We have had them, we have women or people in detentions, places of detentions, people in institutions, and other issues. There are upcoming ones actually from our office on minorities, and also one on indigenous peoples that will come there. But they are, broadly speaking, and dealing with all of the different kinds of rights, and not to forget that there also is this very strong civil political rights aspect to it that really has to do with the governance of our societies into the future, and making sure we had, for instance, also another guidance on emergency measures as such. And of course, as we know, it's not just that it has to be legal and necessary, proportional and so on to the outcome, even the kinds of restrictions we have on movement, not to speak of others. But the main point is that the measures have to be limited in time as well. And that exactly goes against this larger issue that I think that we're facing the risk in the world, unless we engage with multilateralism in a constructive and positive and active way. If we have the leadership we need, which unfortunately we sometimes don't feel so comfortable with, that we actually are sure we have. But this is where we do need to take the lead. And I fully agree on the point that it's not just the global level, the multilateralism of the UN, but cooperation with the regional organizations, institutions, and of civil society, and all of the networks and the academic networks. Really, I think a very deep level of multilateralism. So not just intergovernmental, but all of the different actors, business, of course, as we know, the private actors that are essential for this. And all of that is needed, I think, to make sure that we take on these challenges that are really very serious long-term challenges.
Yeah, and I think the scapegoatism as a means of politics and policies needs to be overcome as well, because I think that is extremely dangerous all over the globe. To a certain degree, scapegoatism has been used by populist governments sort of a lot. And I mean, in this time of crisis, if I may say so from my own viewpoint, I would think that populists have shown themselves up in these times of crisis, because when we look at the statistics and the responses to the crisis, it's often the populist states that have responded worst, actually, and that they have shown themselves up completely. At the same time, it's exactly those populist leaders that are trying to push through their agendas. So it's a matter of transmission, of transmitting that information as well, so that the ordinary people see what's actually happening in their countries in comparison to other countries as well. Because one thing that frightens me personally is the fact that we were more or less forced and more or less willingly gave up all our individual rights overnight. We were locked in apartments for 50 days and so on, had no rights left whatsoever, and we feel, and talking about stuff about a community of people, feel completely disempowered at this stage, and that's a very, very dangerous situation to be in, I think. But let's come back to the minorities, to minorities. I have a couple of comments coming in. The data that is coming in from the US, from the UK, and from the EU quite clearly show that COVID-19 infections and deaths are higher among migrant minorities of African, Asian origin compared to other groups. We seem to have some inclinations why that is the stage, why that's the way. Do we also associate that with the social issue that COVID-19 has raised very, very clearly, showing that social groups of lower stratas suffer much more than higher educated, more wealthy people. How do we compare this? How do we tally this with the minority issues? Are social issues and minority issues going hand in hand there? Are they clearly distinguished from each other? Or do we have a meddling of issues there? Joseph, do you want to come in? Yeah.
Yes, yeah. I think this is a very good point, which needs a lot of discussion. And what I referred to in the very beginning as the confusion between integration and assimilation. I think there's a lot of misunderstanding between these terms, and not even in sociology or in social sciences in general. There is a consensus on these two terms. What do you mean by integration and what do you mean by assimilation when sociologists, for instance, distinguish between cultural assimilation and so-called structural assimilation? And what you referred now with the status of people and of course of groups. I think we have to see that all our Western societies, but not only Western societies, are stratified. So we have to give up the idea that everybody is by nature equal. All societies, whatever sort of society, has some sort of hierarchy, some sort of stratification. And the question is therefore, do we think about the special requirements for different sorts of stratification? Socioeconomic stratification has been already addressed by Ilze very much, but also ethnic stratification based on describing minorities like Roma or the First Nations in Canada as inferior, simply as inferior because of their being indigenous or somehow other than the majority population. So this is then called ethnic stratification, and the worst case scenario is if socioeconomic stratification is multiplied with ethnic stratification, so that we then have this intergenerational cycle of poverty. Which we can see in Europe with Roma, Sinti, and all these groups all the time, with Roma pupils not being able to finish primary schools or have a higher dropout rate in secondary schools, and then much less chances also for on the formal labor market. So they are excluded from the formal labor market in the very beginning, so that you end up in this cycle, intergenerational cycle of poverty and status inferiorization. And these are the deep structures of all our also Western societies. And I'm afraid that COVID-19 is saying, well, now we need to prevent measures to spread the virus, and so we need emergency measures. But emergency measures can only turn also in preventive measures, and this is also a question for Lamberto Zannier and conflict prevention as and his office as a conflict prevention institution. Emergency measures can only turn into effective prevention measures if we also tackle the underlying, under the surface, underlying deep structures of our societies in terms of assimilation, segregation, and marginalization of all these groups which have been mentioned so far.
Absolutely, I couldn't agree more. I agree with Joseph when he was saying that this goes back to insufficient degree of integration. If if there isn't enough integration, you start seeing divisions within the society, and the weaker, marginalized groups are the ones who then have difficulties. There are difficulties of all kinds. They might have, first of all, difficulty in accessing healthcare services compared to others. But they might also have some of the problems that are accumulated with poverty and with a lower, how can I say, social status. The habits, the cultural habits, and the way they live, the difficulty may be in implementing distancing measures, but also the question that with the lack of equal opportunities for all, they keep circling in this environment of lack of development, which then also creates for them health problems, for instance, from obesity to whatever else. And so it exposes them to higher degree of risk compared to other parts of the society. So these are only examples, but then this creates also this negative spiral things, because then they become objects of discrimination, hate speech also within the society, targets, and the Roma are the typical example. And we see the discrimination of the Roma now in the actions of law enforcement bodies in a number of countries, also in Europe, where they've been targeting, drone surveillance, even remote control of the temperatures of some of these groups. And they've been deprived of opportunities also to continue their economic activities in a forceful manner, but without measures that would alleviate their condition. So there are very worrying signs of discrimination, plus the hate speech that we see surrounding them and surrounding others. This otherization that we see emerging and that we see in many areas. We have also positive examples. I've seen, for instance, in Georgia, where in one of the minority villages, an Azeri woman, ethnic Azeri, was accused of introducing the virus in the local municipality, and then through the social media, a campaign started against her and against this ethnic group. The minister for Reconciliation Civil Affairs intervened to stop this, and very forcefully. So there is a room for, and there are good models of interventions of governments to address this, when there is, of course, a willingness to do that. And what worries is that not everywhere there is this kind of thing. I've seen today, for instance, in Hungary, the higher court took a decision against local institutions that had segregated some Roma kids in education, saying they should have been integrated and the opportunity should have been given to them. So there are signs, even in complicated environments, that something can be done to work to try to better integrate the communities. And that is the starting point, because I think what is important of also what Joseph Marko was saying is that these issues, what one needs to address is the root causes of the long-term problems. So if you address the various pillars of integration policy one by one, and try to promote inclusive integration policies, then down the line you will have a more stable and more balanced society.
That ties in with a question that has just come in, and that focuses on the re-centralization of power, literally, in the nation states. And you just mentioned a second ago, it takes a certain, or it requires a certain willingness on the side of the nation state to engage with this. How likely is it, because they have found a sort of a regained strength now in their capitals, is it likely that we see sort of an engagement with these multilateral policies, or are the UN and the OSCE able to assert more pressure on nation states or to engage them in multilateralism? Ilze, would you like to come in on this one?
Well, as a first take, I'm sure others have more interesting things to say. No, of course, one cannot force states to come onto this dialogue in multilateral settings. We can do what we can from an institutional setting to make it possible and to make it interesting to do so, and to urge and encourage countries to do so. However, the more important part is precisely that those member states themselves who already are convinced that this is the way to go, and luckily there are good champions of multilateralism and across the world. I note that, for instance, China, in its recent Security Council presidency during that month, had planned to have COVID intervene, so it wasn't possible to do it in presence, but they had planned to have an event specifically to encourage multilateralism, the importance of multilateralism, for instance, so that there actually are strong pockets of support for multilateralism across the world. And I think that that's really the engagement by member states themselves to get others on board to come and discuss this matter, and to really, that will exert more pressure than the institutions themselves can do, of course. But certainly it's a matter of keeping the dialogue there and showing, I think as always, it's a matter of showing that it is in the self-interest of states to do so. This is the key point. It's not going to happen out of some kind of commitment to a principle, but the fact is that we get better outcomes because of that kind of cooperation, and it's absolutely essential. But of course, we need leaders among member states to be able to do that. Thank you.
Thank you. Thank you so much. Joseph, are you coming in on this?
Yes, you basically raised the question, is this now the hour of federalism?
In a certain way, yes, yeah.
as a new starting point, and I would say yes and no. Yes, as far as the principles are concerned, yeah, because it becomes very clear also from my tiny little Austrian perspective, yeah, that on the one hand, we have this centralization, we have strong government at the very moment, strong leadership, and at the same time also a lot of problems, therefore, when mayors of even small municipalities simply act on their own, yeah, without consultation, coordination, or cooperation. And in this sense, from a principle perspective, I think, yes, this is the hour of federation and federalism as a model again to say we need some balance, yeah, between the smaller communities and the bigger unities, whatever the unity is, whether this is the region, the nation state, or humanity as such. But it is clear that balancing is the most difficult problem, which cannot be mathematically defined for each and every country or member state of the UN. So that we end up again in the question, yeah, how much multilateralism do we need between international organizations, with the member states of these international organizations, and within, yeah, these member states. And this is the tricky issue, which will of course be a lot of debate in the future years to come, I guess.
Yeah, yeah. That's almost a finishing statement of you, Marko. We're very much against the time there. And Ilze ended up on a very positive point as well. Lamberto, do you have any sort of cause for optimism to finish off on our webinar today?
Actually, I'm very moderately optimistic on this, based on what I see. I don't see all this push coming. We would have to see, some of those leaders who have disinvested in multilateralism, how they are faring. And will they be, will people continue to support them if they fail in their policies? So we'll have to see, and some of these things are out of our hands.
Yeah.
But I think there is what is important. Ilze was talking about leadership. I think that it's also a matter of leadership within the multilateral system. It is important that we articulate our messages in a way that they come across clearly, and that they show that there is a real need for this strengthened joint endeavors to address these issues, global comprehensive policies as opposed to closing behind and hiding behind the borders.
Yes, I would agree with that. Now, on that point, let me thank you very much so far, panelists and external contributors alike. Time is small, it's catching up, it's 4 o'clock now, and I would like to bring this webinar to an end. Thanks to everybody, the contributors, Ilze Brands-Kehris, Assistant Secretary General of Human Rights at the UN, Marko, Head of the Institute of Minority Rights at Eurac in Bozen, and Lamberto Zannier, OSCE High Commissioner on National Minorities. Thanks also very much to my Eurac colleagues who have made this webinar possible, namely Sergio Constantine, who worked on the questions, and Johanna Mitterhofer, who is the spiritual director in the background. And let me finally remind you that this was only the first of a number of webinars the Institute for Minority Rights is hosting. The next one will take place on Thursday, May 21st at the same time, 3 to 4 p.m. The title being Equality, Discrimination and COVID-19. Thank you very much to all of you, and have a good evening or a good morning to you, Ilze. All the best. Thank you very much. Thank you.
Thanks to you.